my name is Ashley Johnson, and for my Session 3 presentation, I've entitled it Raynaud's Disease, Keeping Your Hands Blue Since 1862. Have you ever looked down at your hands and maybe you notice that your fingers have turned white? Maybe your fingertips are blue, they're kind of numb. No matter what you do, you can't get the color to come back. Well, for some of you, that answer might be no, probably a majority of you. But for others of you like me, the answer is yes. Yeah, Ashley, I have noticed that. If you're not sure what I'm talking about, let's take a look at the first image. Here it shows every finger but the index finger, that white shade of color. Almost like a moldy shade, with the index finger remaining red with normal circulation. Now, as I stated, this is a circulation thing. But what causes these circulation issues? Well, the formation of your white fingers is caused by vasoconstriction. So when your blood vessels are normal, they are at a normal size, nice and round, filled with blood, lots of perfusion, getting oxygen everywhere in your body. But with Raynaud's, near your fingertips, maybe your nose, things like that, these blood vessels constrict, causing lack of circulation, discoloration, and eventually oxygen loss, which is what causes your fingers to turn blue. Now, whenever I said that a majority of you may not experience this, that's because only 5% of the world population is said to experience Raynaud's, with 15% of that being in women, but we'll get to that later. So, going back to the cause, what causes this? What causes my fingers to turn this weird white color? Well, other than the vasoconstriction, it actually has to do with estrogen levels, which is why it's linked to women more often. And it's triggered by temperature changes and stress. So us women living here in places like Colorado are more likely symptomatic than, say, women living in Florida. As we take a look at our next slide, it shows an image of what that vasoconstriction looks like and just gives us a better picture. As you can see in one of the image, once again, those blood vessels are perfectly circular, and they're round, and they're plump, and they're filled with blood, which is what we want. And then the other hand is a hand, what mine looks like if you took an image to it, where my fingers start to lose circulation. Once again, not a bad thing if you can get it controlled, but control is a big deal with this condition. So like I said, it affects various body parts. The most common one is fingers and toes, just because those are the furthest away from your heart, but it can also affect things like your nose. And the National Institute of Health gives plenty of information about this, including the other areas of the body that you may not know that it affects, such as your ears, your nipples, and places like that. In addition to the discoloration, it causes your fingers and whatever part it is affecting in your body to turn or to become numb and maybe cause a tingling feeling. And the tingling feeling tends to happen when the blood is perfusing back into your hands and fingers. Now, if you see that your fingers have turned white, don't be frightened. The color will come back, and it usually takes about 15 minutes after your episode is over to have all of that blood, all that perfusion to reoccur. So what puts you at risk for things like this? Well, like I said earlier, it affects women most often because of its link to estrogen. Now, it's been studied that estrogen actually affects your body's reactivity levels in terms of temperature change and stress. So this causes your blood vessels to contract and dilate differently than in a man. And once again, 15% of women between the ages of 15 and 40 are said to have this condition. Once again, you're not alone. We're with you. Another thing that can affect it is living in a cooler climate. I'm originally from Oregon, so whenever I was living in Oregon, it's cooler, but I wasn't as symptomatic as I am living here in Colorado, which is why I have to be careful and why I always carry things like my mittens and my hand warmers, which are a godsend. They're great. Another thing that can affect your chances of having Raynaud's is family history and pre-existing conditions. Now, if you have a pre-existing condition such as carpal tunnel syndrome or any issues with your blood pressure, you would have what is classified as type 2 Raynaud's or Raynaud's phenomenon versus type 1, which is just caused by environment and stress and factors like that. Family history also goes into play, just like with everything in healthcare. So my family has a history of poor circulation, diabetes, and issues with their blood pressure. Therefore, I was more at risk for having the condition, which is why I have it now. So one of the most important things to do if you are sitting here saying, wow, Ash, I have this. Like, I experience this daily, or I experience it when I'm stressed. Get the medical attention that you need. Having Raynaud's has caused me personally to have not only issues with circulation, but issues with healing. Anytime I get a cut on my hand or something on my feet, it causes me to heal slower because I don't have that blood perfusion all the time. It can also lead to ulcers and gangrene or even amputation if things are not treated properly. And there are solutions, so get the help that you need. You don't have to suffer. But more than anything, be your own healthcare advocate, as with anything. This condition may look simple, but it's complex. But don't let that scare you. When I was working family practice, I saw so many patients come into me and the doctors that I work with, and they were scared. Don't let your fear get the best of you. It's okay. You are not alone. And I truly believe that there are more people out there that are maybe confused as to why they have this condition or what it really is. So keep this presentation not only for yourself, but to educate others and prevent the complications. If you have any questions or you want further information, here are some resources that can be provided to you. Mayo Clinic is awesome. The National Institute of Health has many other resources, or even just calling your own healthcare provider, they can hook you up with what you need. Thank you again for listening. Have a great night.